Hello everyone, I'm Lily. I'm a board-certified general psychiatrist and addiction medicine provider at the University of Alabama at Birmingham. Today I'm going to introduce you to new buprenorphine practice guidelines. In the meantime, I'm also going to discuss how this new policy affects the access to opiate use disorder treatment. I have no conflict of interest in relation to this topic. So before the COVID, patients with this disease has been struggled to locate and to remain in the treatment. Of course, COVID-19 make each of our life hard, especially for our patients with opiate use disorder. These patients are very vulnerable. They are trying to find and to remain in the treatment. However, there are so many barriers there. CDC released the data in September of 2020. The data indicated that over 90,000 patients who were overdose deaths. So increased amount of overdose deaths have clearly indicated that we should do something to stop opiate use disorder, in the meantime to reduce overdose deaths. So in an effort to combine overdose death, Department of Health and Human Resources have released a new guideline which to allow the practitioners to practice in a different way. So this new guideline is focused on buprenorphine itself. Under this new guideline, eligible practitioners are able to prescribe buprenorphine. They are not required to go through the old way, which is 8 hours of training for physicians, 24 hours training for middle-level practitioners. However, all the eligible practitioners are still required to receive their X-waiver numbers in order for them to treat the patients with opiate use disorder using buprenorphine. In order to receive X-waiver numbers, practitioners are required to receive X-waiver numbers by going to SAMHSA website. When they are going to SAMHSA website, they need to write down their DEA registration number and a valid state license number where they are going to practice. After their application is approved, they will receive X-waiver number. So whenever they see the patients and prescribe buprenorphine, they have to write down X-waiver number in order for the pharmacy to verify the prescription. This new policy allows the practitioners to see the patients less than 30. If any interested practitioner who are willing to see the patients more than 30, they are still required to receive the training. For physicians, it is 8 hours long. For the middle-level practitioners, it is 24 hours long. So the second change in this new guideline is that practitioners are not required to refer the patients for the psychosocial counseling. However, it is still highly recommended for practitioners to share the information with the patients about the importance of psychosocial counseling. They can always share the patients in this website, which is findtreatment.gov. As an addiction psychiatrist, I cannot wait to see in the next few months the eligible practitioners could take advantage of this new policy to see the patients and to treat the patients with buprenorphine. In the meantime, I really wish that this new policy will significantly reduce overdose attempts and overdose deaths. Thank you all.